Greetings everyone, this is Timothy Youngs, the Digital Apothecary, and today I'm going to be talking about, for pharmacy students, what do you do if you're interested in digital health? And also for pharmacy students, what 5 things should you know about digital health? I think this is probably a good starting point as I try to gravitate towards more about, the future generation of pharmacy practitioners about what they should know about this upcoming field. And I say that tongue-in-cheek because the up-and-coming field is kind of already here. Things are being developed, but more or less implementation is still down the path. And I'll give you some background. So digital health has been a term that's been thrown around probably for the past 5 years, but it's older than that. We have mobile health, which has been around for almost a decade more, and the whole time, and you can shorten it as M-health. But the reality is that, digital health is kind of this huge area that has had a lot of emphasis in terms of how technology can improve basically patient care. And I'm going to have another video up if you want to watch about what exactly digital health is, if you want to break down subcategories, so you're welcome to watch that. But I'm going to talk about more of what I think is certain areas that matter for you. So let's start. I would say probably the biggest thing is just recognizing what is mobile health technology. So talking about mobile apps and wearable devices, I think is probably the first thing. So what is a mobile app? I mean, you probably have dozens on your phone at this current time. If you think about it, you carry around this ubiquitous device that has basically some knowledge of mankind on it almost at this point. You can look up almost anything on the go, and yet we can also use it for dating. We can use it to get food delivered to us. We can use it for shopping. Amazon Prime Days just ended. You can use it to get a taxi through Uber. So this on-demand mentality has grown huge, and yet how can we apply it for healthcare? That's like the big thing right now. One of the things that are coming up is, if we think about, is wearable devices. So you had like Fitbit, which people would connect on their hip. That was basically a smart movement tracker that could say, oh, you walk this many steps. So it starts small there, but then it gets bigger, and it gets way bigger. One of the things that I think really led to it is that I was to say it would be, the Apple Watch, or also watch-based technology that has really huge market now. And these things are basically taking off because now you can do so much. Now you get notifications just on your device. You can tap little messages. You can do little things like that, get alerts. But okay, that's a starting point. But what about going further with that? If you haven't been watching and haven't been keeping up with the news, one of the big things is that Apple Watch now allows them to basically monitor and track anytime someone has atrial fibrillation. So just think about it. So if we talk about AFib, what medication management goes into it? You have rate versus rhythm control, with rate control being very big, and the Apple Watch can detect heart rate, but now you can detect rhythm. So what can you go with that? Now, you guys know that AFib is a huge undiagnosed problem in a large amount of population. One of the biggest issues with that is not only the symptoms from AFib, but also the fact that it increases your risk significantly for developing a cardioembolic stroke. How do you treat that? Anticoagulation. And if we get down to anticoagulation, warfarin's been on the market for a long, long time. But now we have the DOACs, so directly oral anticoagulant drugs, such as rivaroxaban, apixaban, the Bigatran, list goes on and on. That seem to keep coming out. But now you have companies like Janssen teaming up with Apple to basically help detect AFib. And then obviously they wanted them, probably get them started on a DOAC. Makes sense, right? So if we had to talk about it and we're looking at this, then we're getting to a point where we had these wearable devices and mobile apps being tied together with our medications and treatment. Other things coming to the fore is digital therapeutics, and that's basically the idea of a app or software that can basically provide a clinical endpoint with evidence to back it up. It's not even a medication more, it's just an app. And we're getting into substance use disorder, we're getting into sleep, we're actually getting into chronic pain. These are all things that are coming to the forefront. Imagine, when in a few years, when we are not only just dispensing medication, but we're also saying you need to set up this app to use and integrate with that. And along with that then leads to the next point, is medication adherence. I think is a huge one. And I look at medication adherence as a section where technology can basically really increase the way that we track adherence. I mean, and you can watch my other videos about adherence and how that goes into play, so I won't go into depth. Just watch those and you can see talking about traditional adherence versus new technology coming out, and I'm also reviewing them. But I think that's one that's going to be a pretty big area for us because it's going to build into another area. is remote patient monitoring. So remote patient monitoring is the idea of remotely monitoring patient endpoints. So we've been doing that for a long time as well. I mean, you can give a phone call to a person saying, oh, pick up your medication that's due. Also, how are you doing and such. But we can go even beyond that. There's been telesystems in play for, let's say, heart failure. So after you get out of a hospital due to heart failure exacerbation, you go home, and every morning you have to basically stay on the scale, weigh yourself. You have to call the nurse, answer some questions, relay information, measure your blood pressure, heart rate. And that all comes back to medication management, because we're thinking about, weight with diuresis. We're also thinking about blood pressure control and heart rate control, but there are also key medications to help their heart rhythm remodeling, such as an ACE inhibitor or Entresto or a beta blocker as well. So we have all those kind of things to consider. But it's even going beyond. So Apple, not Apple, but AliveCore is another company that's playing with the idea of using an EKG, which can also be used as a band on the Apple Watch to detect potassium levels. So now we can actually monitor potassium levels without even having to get blood work. I mean, that's really cool, because that impacts a lot of things. So think about how many medications cause hypo or hyperkalemia. Think about how that affects them clinically in terms of maybe safety from, let's say, arrhythmias and such. So this is a huge area. So the whole idea that, could we actually reach a point in our profession where not only are we responsible for inventory and management, dispensing medications, and also going and making sure medications are appropriate when they're being prescribed, but now we also monitor patients after they get there on their medication to make sure they're fine. And it could be different things, such as different devices out there. So let's say, you have this Bluetooth enabled blood pressure cuff and the person has it at home. Well, suppose they get started on antihypertensive. We educate patients to say, oh, you have to watch out for signs and symptoms of hypotension. Also, you can wear a device and do it. But now what if we could actually monitor and we could see, are they actually developing hypotension? Or let's suppose we could also monitor adherence, and we could say, this person's not being adherent and their blood pressure is not reaching goal. Can we reinforce this for the patient? Or they are being adherent to therapy and the blood pressure still isn't at goal. Could we then expand into disease management through digital health? And that's another one I want to say. In which case, can we reach a point where we have protocols in place and say, person was started on ACE inhibitor, not at goal, pharmacy is allowed to titrate it up further, or add on therapy, let's add on amlodipine, 5 milligrams, because they're at the Cinepol 20 milligrams, we don't think they can go higher or something like that. But this is how we kind of build upon it. And what we're getting to the point is that we can use this technology to basically reinforce patient care, because we can have it. And I think we could also fit better into a clinical team, because I think that's also kind of no-brainer stuff. I think almost every pharmacist is clinical, and from that perspective, we can do these types of things. It's just, can we be enabled? And the biggest weakness has always been subjective versus objective information. Digital health offers a plethora of objective information out there for us to utilize, and from that we can actually probably leverage ourselves and do more. And for me, I don't even look at this prescription encroachment on prescribers. We're not trying to take over and diagnose. We're not trying to basically say, oh, we're going to basically be prescribing only. We're kind of looking from this collaborative practice kind of what mechanism where we can use technology and the devices and the information gathered to basically help provide this patient care in a means that really hasn't been able to be addressed in the past. Other things to consider would be drug information. I think we're also entering an era where, just knowing everything on top of your head is not really feasible. There's more drugs on the market than there were in the past, let's be honest. You probably have preceptors say, oh, you should know this, this, this. But the reality is, even I struggle with it. So there's only so much you can memorize. Having mobile devices that, can serve as remote drug information databases is great. Especially when you consider the stuff that I used to have to carry around as a student. It's amazing how far we've gone with that. So, is there ways that this clinical decision support tools could be built into our own pharmacy management systems or beyond, where they're better at terms of integrating data, analytics, pharmacogenomic data, and basically put out to us oh, this is stuff you should consider, or nudge us to basically do better interventions for patients? I think that's something that we should really consider where we can get from. And one of the reasons why I think is because we're going to have a very different scope of studies that you're going to have to understand. Right now you probably hear meta-analyses are really huge. You have randomized controlled trials that reinforce that. Then you got observational studies and such, and prospective versus retrospective, all this stuff, and maybe drug lit that you have, or evidence-based medicine. But now we throw in this other one. Have you ever heard of real-world evidence, or RWEs, and the implication those have for basically how we will address patient care? Have you heard from any professors talking about the integration of wearable devices into a clinical study? There's a bunch of these coming out. Like they can actually detect, let's suppose that someone has Parkinson's. Like imagine like on off time with treatment. And then we're saying, okay, we're on this, and they're wearing a wearable device, and we can actually detect if they have any basically movement discrepancies that may signal, okay, is the drug working well or not, or maybe like fall risk for medications and such, or just other clinical endpoints. So I think this stuff is all going to reinforce each other and really bring down things to a point where medication management strategies really goes to a different level. And along with that is also our patients and how they'll integrate with things. They're going to be getting alerts on their phones saying, oh, your blood pressure is low, your potassium is high, things like this. They're probably going to want someone back end monitoring all this and to basically talk to you about it. So I think like telemedicine services and getting us familiar with talking to patients in our home through a remote device. You guys are probably, watching me on YouTube. Think about like just doing this kind of thing, like just talking to a patient through about their medical stuff while you like look at the computer and like, oh, this is their data history and such. Let's talk to you about where you're at with that and how that fits into clinical patterns. That could be something very big for us. So, summing this all together, I think these are things that, if you're a pharmacy student wondering where technology is taking us, these are some things that be really high up on your radar, and maybe talking to your professors about, maybe talking about when you go to any organizations or societies or having meetings. I would say if you're really fascinated by a thing, look at yourself in your region. Are there people you can bring in to talk to you about this technology? Any informatics pharmacists, people from industry, people from startups that you maybe have nearby, and just have them come in and talk to you. Because these could also be areas that you yourselves could look into as a possible new employer or a new place to go and basically get training in as well, or an internship. I think we all the time in academia, we tell students like, okay, you're either going to go staff, community hospital. There's some other things in there like nuclear, LTC. And yes, there's a lot of stuff. But then residency to go clinical or fellowship for industry. Like those are often like the three things that we tell students. And I honestly think we negate to tell you guys that there's so much more out there. But I think this whole technology stuff opens up a new pathway that we never really even considered before. And I think, honestly, I hate to say it, a lot of it's on you as a student to kind of gravitate and go explore out there and see what is available. But I hope this serves as kind of like a spurring moment for you to consider, these are things I need to look into. These are things I should probably be aware of at least, and maybe it's something of interest, I can go down that pathway as well. But you won't know what you need to know unless you start networking. And, there's one old axiom I heard that I love. Pharmacy school isn't just about the grades you make. It's also about the hands you shake. It's about that whole networking thing and figuring out where you want to go and grow to as a person. So this is Timothy Young's, the Digital Apothecary, and hope you have a good day.